Hello there, I'm Kate Miles from the Mind Body Reset, and I'm here today to talk to you about osteoporosis. Now, osteoporosis is a health condition that creates a thinning and weakening effect on our bones. This makes them fragile and therefore far more likely to break. This bone thinning process is, to a degree, just part of the natural aging process, which develops slowly over many years, but for some this progresses far further than is considered normal, and is sadly often only diagnosed when a fall or sudden impact causes a fracture. Most common injuries in people with osteoporosis are a broken wrist, hip or vertebra. However, breaks can also happen in any other bones, such as the arm or pelvis, usually as a consequence of an impact. But rib fractures can sometimes even happen just because of a cough or sneeze. Now, osteoporosis is not usually a painful condition unless a bone is currently broken, but the partial collapse of spinal bones, especially prevalent between the shoulder blades, is a common cause of long-term pain, which is when the characteristic curved or stooped forwards posture becomes very evident. The precursor to osteoporosis is referred to as osteopenia, which is a level of bone thinning beyond what is considered normal for your age, but not severe enough to be classed as osteoporosis. These changes are visible on bone density scans and give a good indication of your future osteoporosis risk. However, osteopenia does not always lead to osteoporosis. This depends on many factors, but there are positive steps you can take to reduce your risk of developing osteoporosis and therefore keep your bones as healthy as possible. To achieve this, though, it is very important to understand the causes of osteoporosis and osteopenia. Women do tend to lose bone density more rapidly during the first few years after going through the menopause. Therefore, even though men's bone density also reduces with age, women do tend to be more at risk of developing osteoporosis as a consequence of this window of rapid reduction, especially if their menopause begins before the age of 45 or they have had their ovaries removed. However, osteoporosis can also affect men, younger women, and even in some cases children, because many other factors also increase the risk of developing osteoporosis, including taking high-dose steroid tablets for more than 3 months, or the long-term use of medicines that can affect bone strength or hormone levels, such as anti-estrogen tablets taken after breast cancer. But you must not stop your medications without being directed to do so by your doctor. Other factors to consider are medical conditions, such as those creating inflammatory, hormone-related or malabsorption concerns, having a family history of osteoporosis, having a current or prior eating disorder history, such as anorexia or bulimia, being classed as underweight, not being active or exercising regularly, plus drinking and smoking heavily. If you have osteoporosis or osteopenia, are considered at risk of developing osteoporosis, or you wish to prioritize your future bone health, then it would be well worth considering implementing the following steps to preserve your bone density. Focus on healthy eating, especially by including foods in your diet that are rich in calcium and vitamin D. Taking a daily supplement containing 10 micrograms of vitamin D3, and seeking advice on whether or not calcium supplements are right for you. Plus making lifestyle changes such as giving up smoking, reducing alcohol consumption, and undertaking regular weight-bearing exercise. Please do start slowly, however, by moving at or just beyond your current capabilities, such as by walking or stair climbing. Then, if you wish, build up to dancing, jogging, hiking, football, netball, racket sports, weight training, or using resistance bands. But if you suffer from aches and pains, fatigue, or have a medical condition, please do ask your medical practitioner what would be the best approach for you. And remember, it is appropriate to stop if you feel unwell or experience any pain. Treatment for osteoporosis is based on addressing and preventing broken bones, plus taking medication to strengthen your bones. So if you do have osteoporosis, your doctor may prescribe daily, weekly, monthly, or even yearly bone strengthening medications, depending on how weak your bones are and your fracture risk. So whilst talking therapy and sedimentology plus remote energy healing practitioners can't cure osteoporosis, they can help you adjust to your diagnosis, encourage you to find a way to prioritize favorable lifestyle changes, and also help you to reduce your pain and energy issues which may be limiting your ability to increase activity to an appropriate level in order to aid your balance and stability. Now, if you're a busy woman with health concerns, please join my Mind Body Reset group to access our self-help posts and videos to help you further boost your health and happiness. Thank you for watching. I hope you found that helpful. Bye bye.